Welcome to the Full Freedom Life channel. Watch this video on the impact of influenza and pneumonia in America. Click like and subscribe and learn to live simply, healthy, wealthy, and happy every day. Influenza and pneumonia are two respiratory illnesses that have a significant impact on public health in America. Let's discuss each of them separately. Influenza, commonly known as the flu, is a contagious viral infection that affects the respiratory system. It is caused by the influenza virus, and its symptoms can range from mild to severe. The flu is typically characterized by the sudden onset of symptoms such as fever, cough, sore throat, runny or stuffy nose, body aches, fatigue, and headaches. In some cases, it can lead to complications such as pneumonia, bronchitis, sinus infections, and ear infections. Certain groups, including young children, older adults, pregnant women, and individuals with chronic health conditions, are at higher risk for developing severe complications from the flu. Influenza seasons in the United States typically occur during the fall and winter months, with varying levels of severity and impact on different populations. Pneumonia, on the other hand, is an infection that inflames the air sacs in one or both lungs. It can be caused by various pathogens, including bacteria, viruses, and fungi. Pneumonia is typically characterized by symptoms such as cough with phlegm or pus, fever, chills, shortness of breath, chest pain, fatigue, and sometimes nausea and vomiting. The severity of pneumonia can range from mild to life-threatening, particularly in vulnerable individuals with weakened immune systems or underlying health conditions. Pneumonia can be acquired in the community. It's known as community-acquired pneumonia, or may develop in a healthcare setting known as hospital-acquired or healthcare-associated pneumonia. Both influenza and pneumonia have significant impact on public health in America. Influenza-related illnesses and hospitalizations contribute to a substantial burden on the healthcare system, particularly during more severe flu seasons. Each year, influenza vaccines are developed to provide protection against the circulating strains of the virus. Vaccination is an essential preventive measure recommended for individuals aged 6 months and older to reduce the risk of flu-related complications and transmission. Pneumonia, often as a complication of other respiratory infections, also poses a substantial health burden in the United States. It can be prevented through various measures, including vaccination against specific pathogens such as Streptococcus pneumoniae, and practicing good hygiene, such as frequent hand washing and avoiding close contact with sick individuals. Public health organizations and healthcare providers in America continuously monitor and respond to influenza and pneumonia trends, implementing measures to prevent and control the spread of these illnesses, promote vaccination, and provide appropriate treatment for those affected. To help prevent influenza or flu and pneumonia, you can follow these steps. Number 1. Get vaccinated. The best way to prevent flu is by getting an annual flu vaccine. It's also recommended to get vaccinated against pneumonia, especially if you're at high risk or older. Number 2. Practice good hygiene. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your face, especially your eyes, nose, and mouth. Like this video so far? Then click like and subscribe to the Full Freedom Life channel to learn how to live simply, healthy, wealthy, and happy every day. Number 3. Cover your mouth and nose. When coughing or sneezing, cover your mouth and nose with a tissue or your elbow, not your hands. Dispose of used tissues properly and wash your hands afterward. Number 4. Avoid close contact. Try to avoid close contact with individuals who are sick. If you have flu-like symptoms, stay home and limit contact with others to prevent spreading the illness. Number 5, maintain a healthy lifestyle. A strong immune system can help protect against infections. Eat a balanced diet, get regular exercise, manage stress levels, and ensure you're getting enough sleep. Number 6, keep your surroundings clean. Regularly clean and disinfect frequently touched surfaces and objects, such as doorknobs, light switches, and electronics, to reduce the spread of germs. Number 7, practice respiratory etiquette. Use a tissue or your elbow to cover your mouth and nose when coughing or sneezing. Dispose of tissues properly and wash your hands afterward. Number 8, avoid smoking and secondhand smoke. Smoking damages the lungs and weakens the immune system, making you more susceptible to respiratory infections. Number 9, stay healthy when traveling. If you're traveling, especially during flu season, take extra precautions like practicing good hygiene, avoiding crowded areas, and getting vaccinated. Number 10, consider pre-exposure medications. In certain high-risk situations, such as if you have weakened immune system or are exposed with someone with a respiratory infection, your healthcare provider may prescribe antiviral or antibiotic medications for prevention. Remember that these tips can help reduce the risk of flu and pneumonia, but they don't guarantee complete prevention. If you have specific concerns or health conditions, consult with your healthcare provider or personalized advice. Influenza and pneumonia are two respiratory infections that can cause significant illness and complications. While they share similarities, they are caused by different pathogens. Influenza is caused by the influenza virus, while pneumonia can be caused by various bacteria, viruses, or fungi. Both influenza and pneumonia can lead to severe symptoms, especially in individuals with weakened immune systems, the elderly, and those with underlying health conditions. Influenza typically presents with symptoms such as high fever, cough, sore throat, body aches, and fatigue. Pneumonia, on the other hand, often includes symptoms like cough, chest pain, shortness of breath, fever, and fatigue. Preventing influenza and pneumonia primarily involves proactive measures. These include getting vaccinated against the flu annually, practicing good hygiene by washing hands regularly, covering the mouth and nose when coughing or sneezing, and avoiding close contact with infected individuals. Maintaining a healthy lifestyle, including a nutritious diet, regular exercise, stress management, and adequate sleep, can also support a strong immune system and reduce the risk of respiratory infections. Additionally, keeping the surroundings clean and disinfected, avoiding smoking and secondhand smoke, and following respiratory etiquette can further minimize the spread of these infections. When traveling, taking extra precautions and getting vaccinated can help protect against exposure to flu and pneumonia. It is important to note that while these preventive measures can significantly reduce the risk of influenza and pneumonia, they are not foolproof. Therefore, it's essential to stay informed, be aware of symptoms, and seek medical attention if needed. Consultation with healthcare professionals is particularly crucial for individuals with underlying health conditions or specific concerns about prevention strategies. Thank you for watching. Like, subscribe, and click the notification bell for more updates and for more upcoming videos. Till next time, bye-bye for now.